All right, thanks everyone for being here today. I appreciate it. We're going to go ahead and get started on time today. Our topic is a bit of a hybrid, two topics that could be discussed at much further length and much more depth than what I'm going to present today. But I wanted to give you all an overview of both of these concepts. We do have families that struggle with these particular issues or have a limited understanding of mental health and mental health first aid in particular, and psychological safety, which is used quite often as a workplace or an occupational term, but it also has its place here at a school or also just in your home. And we'll focus on a little bit of home and a little bit of what we do here at Verso or at any school, hopefully. So let's jump right in.
You can't tell how someone feels just by looking at them or what they share online. To the outside world, our lives may look perfect, even if in reality they aren't. I'm always worrying about doing well at school, and with the end of year test coming up, I'm not sure how much longer I can go. My thoughts swarm around my head, sometimes keeping me up all night. Some days it's just all too much, and I feel like I'm lost in space. When I did badly on one of my tests, I just about kept it together until I got home. Then I broke down crying in front of my mum. She listened for a bit, and then she told me that, just like physical health, we all have mental health. It's our feelings, our thinking, our emotions, and our moods. She then said that feeling down, angry, and stressed is a normal part of life, just like it's normal to feel happy, confident, and carefree sometimes. We all have positive and negative emotions that come and go based on what's happening around us. These are everyday feelings. Good mental health means experiencing negative emotions. It's not always about being happy. Mum can relate to the feelings of stress. So when Mum suggested I take a break from everything and do something I enjoy, I actually took her advice. So I made myself hot chocolate, snuggle up in a duvet and watched a film. And you know what? Afterwards I felt so much better. Mum should take her own advice.
Most of us only ever share the good things. We don't like to share how we really feel. Every morning when I wake up, negative thoughts stream through my head. Getting out of bed and pretending that I'm okay takes all the energy I have. As the day goes on, the negative thoughts flow from a stream into a river. The water rushes through my head so loudly it's hard to concentrate in lessons. And some days it's so bad it feels like a waterfall trying to pull me over the edge. Everything is so overwhelming. I didn't think my friends would understand when I told them how down I was feeling. But when Sasha opened up to me about how stressed she was feeling, I told her. I wasn't sure how to bring up how I'd been feeling, so I started by saying that I didn't feel like myself. Just her listening made me feel like she understood.
So I'll pause that there. Just want to give you a brief insight. I found that video pretty useful for two different types of stories. And the concept of mental health first aid isn't that you're going to solve everybody's problem or your own child's problem or your problem. It's just that you might be able to recognize that something is different about someone you care about, and then you might be able to facilitate getting resources for them. It's not to put the burden on you as a caregiver to take care of everything 100%. So, as I mentioned, today we're going to explore two key topics: mental health first aid and psychological safety. Both are essential in maintaining a supportive and thriving environment for children, and by the end of our time together, hopefully you'll have a bit more practical knowledge and some tools to use at home, and you'll know how we support our learners here at school. So let's define what mental health is for those of us that aren't crystal clear. We probably have heard the term mental health or just health in general, wellness. The World Health Organization, they say a state of well-being in which an individual realizes their own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to their community. That includes emotional, psychological, but also social well-being as well. So that is a range of things. And as we mentioned from the video, that doesn't always have to be the good things. Mental health isn't a moment in time where you have good mental health or you have bad mental health. Mental health is a continuum of all the feelings and thoughts you might have, and you might be on one side of it today, or every minute by minute, you might change slightly to having more positive or more negative mindsets related to your own mental health. Just briefly, there's the Thai definition, if you want to have a look at that. Hopefully that is correct as well. Mental health is more than the absence of an illness. It's a positive state of well-being. Understanding this definition helps us recognize the importance of maintaining mental health for ourselves, but also our children. Mental illness is not a personal weakness or a failure, but a medical condition that requires understanding and support. Familiarity with these terms helps reduce stigma and encourages seeking help when it's needed. I know there's a lot of cultural differences between the West and Eastern identities related to how we express things like mental illness. In China, they have a term that's related to like a broken heart, and that's how they represent things like depression or emotional instability sometimes. So that means something slightly different in the West, but some cultures, even in the West, there's some Inuit Alaskan populations that kind of refuse to recognize mental health potential problems. And so they will go to a physical doctor to mention, I have headaches, or I have weight loss, or I have problems with sleep. In reality, they're having emotional problems. They might be depressed, or they might have some other family situation going on. But culturally, they're not allowed to express I'm having a mental health issue because they might be embarrassed and there's some stigma or shame. So they present to a physical doctor, and then the physical doctor has to read between the lines with what they're being told by the patient, the client, or the person. And then they might facilitate some assessing and getting them some mental health support along with solving those physical symptoms that might just be kind of a cover story for them. And then they can get the help that they need. There's a few statistics here. I've added them here. They're from NAMI. NAMI is the National Association for Mental Illness in America. There's other things where you can get a wonderful range of support and services, online classes, or just information. And they're a very concentrated resource, so there's plenty of things there for you to learn from. And they put together these statistics. They didn't do these surveys, but they collected them. So here we have 10.2% of youth will be diagnosed with a substance use disorder, so that's alcohol or some type of drug in their lifetime. 1 in 5 teens and young adults lives with a mental health condition. So that represents current teenagers, probably 13 to maybe 20. Not someone that is a hypothetical person, but they are actual people that have been diagnosed and are probably in some form of treatment for that. 50% of all mental illnesses begin by age 14, and 75% of them by your mid-20s. So we often, as a psychologist, we learn the adult mental health issues tend to happen post-puberty, and they lean into more of the later teen years. As someone becomes an independent adult, typically that's around 18 or 20-ish years old when they're off to university, and maybe they lose some of those support systems that was in place when they were in a family unit or maybe living at home. And once some of the support systems and safety factors are taken away, then their reality becomes, I have to deal with this myself, and they may not have those coping strategies. And the mental illness tends to show up a little bit more often then. Or it could just be developmentally. There are things that don't tend to happen for young preteens or children. There may be some signs, but by the time they are full-blown adults, their brain is developed enough to where the chemistry is going wrong in a certain way. So things like visions or schizophrenia, you don't really hear that in younger children, although bias potential for the medical industry or the pharmaceutical industry. They are diagnosing younger and younger people with adult type of diagnoses because that's how they make their money. If you can get more people on their medication, it doesn't mean that they don't have an issue, but the pharmaceutical industry is certainly pushing its way to go further down in the ages. And maybe a decade ago or a generation ago, these types of medications that are pretty serious medications wouldn't be prescribed to people that are under 18 or under 13, but we tend to start to see more of that as the industry develops itself. But that's not so much for you to worry about as a mental health first aid. But in general, it is good to recognize late teens is when adult type of mental illnesses tend to start forming in the brain and starts to affect their daily life as they're not as regulated in high school or middle school. So something to think about there. Diagnoses are based on clinical observations. So you might be able to recognize I'm having trouble sleeping, or I'm having anxiety, or I'm having eating issues. I'm not being able to do the things I used to do on a consistent basis. It's affecting my life. Those are observations, and those are helpful to diagnose somebody with a mental illness or an issue. But you might need to have a little bit more structured interview or an assessment based on a list of criteria to actually be diagnosed with a certain mental illness. Symptoms can vary from person to person. Everyone is different and responds differently to different treatments. So it's not always one-to-one perfect diagnosis, but if you have a range of symptoms that fit a certain umbrella of symptoms, a clinician, which we'll get into later, can probably identify you might have this to a high significance of a high probability, I should say. Having a child with a mental health condition can be a challenge. There are ways to make things easier though. Begin by taking notice of your children's moods, behaviors, and emotions. Early interventions, especially with signs of psychosis, is critical because mental health conditions tend to get worse without any treatment. Many conditions are cyclical, and periods of strong symptoms might come and go. Things like depression is a pretty common one, we've heard that word. Those are not every day for every year kind of thing. It kind of goes and it comes and it gets hard to deal with, and then it gets easier to deal with on its own, which is another struggle with being consistently on medication. There are some mental illnesses or conditions that are diagnosed that might need a daily medication to maintain a level of security for that person, that they can go to work, that they can get out of bed, that they can communicate with others, that they couldn't have visions or hallucinations. That tends to not happen in our age range. Children may also hide certain symptoms by saying and doing things that is expected of them. So they might work around the systems that they're in because they don't want to make trouble for others, they don't want to get in trouble at home, or they don't want their lives to be affected by maybe the stereotypes of being diagnosed with a certain mental illness. That's the Thai version, if anybody wants to read. So now we'll learn a little bit about how mental illness begins.
Mental health conditions are more common than you may think. 1 in 5 youth or young adults lives with a mental health condition. Do you know the warning signs? Like feeling sad or withdrawn for more than 2 weeks. Severe mood swings that cause problems in relationships. Intense worries or fears that get in the way of daily activities. Sudden overwhelming fear for no reason. Or seriously trying to harm or kill oneself, or making plans to do so. Not eating, throwing up, or using laxatives to lose weight. Significant weight loss or weight gain. Severe out-of-control risk-taking behavior that can cause harm to self or others. Repeated use of drugs or alcohol. Drastic changes in behavior, personality, or sleeping habits. extreme difficulty concentrating or staying still. If you see these signs in yourself or a friend, tell the trusted adult. The first step to getting help is to say it out loud. Mental health conditions are more common than you may think.
So those are probably picking a certain diagnosis and giving a few of the symptoms. As a parent or as a friend or as a caregiver, or even understanding ourselves, it's important to recognize if something is different than it used to be. That's where you might start with mental health first aid. The idea that on 4 out of 5 of my school days I couldn't get up on time, and that's happened over a few weeks. There might be something starting for you or for your family member, your child, that you need to start to recognize what else is going on in their lives that's causing this to happen. Is it just an environmental thing, or is it something where it's very different than their typical behavior and it might be a symptom of something else? Unlike diabetes or cancer, there's no medical test that can accurately diagnose a mental illness. A mental health professional will use the Diagnostic and Statistical Manual, the DSM, which is kind of like the dictionary or the encyclopedia of all the mental illnesses that they've defined so far, and that also gets updated about every 10 years or so. There's also an international version of that. It's the ICD, but I probably should have looked that up and written it down before I said that out loud. So those are the two main ones. The DSM is certainly used a lot in the West and for people that are trained abroad, and then the other one is more of an international version with the same kind of structure. People will take the terms or the conditions that you might be bringing to them, and then they will try to put that into one of those categories. And if you have a certain number of traits, you might be diagnosable for that particular mental illness. That's kind of how that works. You tend to not have 10 out of 10 of the things on the list, you might have 6 out of 10 or 3 out of 10. And then a professional will decide, once you've reached a certain number of those traits, you qualify for that diagnosis, so to speak. The manual lists the criteria, including the feelings and behaviors. That also includes things like personality traits. And then you may be classified as having a mental health condition. It didn't change who you are as a person to get that diagnosis. It's just a type of way of identifying that might get you access to some resources to help you in that way. In the same way you might have a differential diagnosis if you went to a ear, nose, and throat doctor, and they might look in your ear and they might say, well, that's okay, but your sinus cavities are filled, so they're going to focus on that type of treatment, and that's the same thing for a mental health. They might say, oh, well, you're not having those symptoms, but you're having these symptoms, and we'll focus our treatment on those types of symptoms. After a diagnosis, a healthcare provider can develop a treatment plan that could include medication, therapy, or other lifestyle changes. So you might be wondering, who can diagnose? The main professions that are able to diagnose mental health issues are psychologists and psychiatrists. Psychiatrists are licensed medical doctors that have completed psychiatric training in a medical school. So they are doctor of that type of psychiatry. They can diagnose mental health conditions, they can prescribe medicine, and they can monitor medication and provide some therapy. Some have added additional training like adolescent mental health or substance abuse disorders or geriatric psychiatry. That might be the first line of defense because often you need some medication potentially. You have to go to a psychiatrist or a general doctor that is trained to give those types of mental health medications. If you don't have someone prescribing you medication and you go to what you might call therapy or counseling, that is done typically by psychologists, people who study psychology and behavior. They tend to hold a master's or a doctoral degree in psychology or another specialty like counseling or social work, education. They're trained to evaluate a person's mental health doing interviewing or one-to-one conversation, evaluations, and testing. They can make a diagnosis. They can provide individual or group therapy, and they may have training in specific forms of therapy like cognitive behavioral therapy, CBT, or other behavioral interventions that are new to clinicians. Or there's some old school like talk therapy, lay on the couch, Freudian style, psychodynamic type things as well. Sometimes you'll go to a mix. You tend to start with a psychiatrist who diagnoses and medicates, and then prescribes a term of therapy based on the psychologist's specialty that maybe you find is good for you. It might be 6 to 12 weeks, it might be a year, hopefully not much longer than that. And some are better than others for certain types of mental health conditions. And some have efficacy that is the same as doing nothing. So, depending on what your issues are or what your cultural views are about medicine, there may be alternatives to the more holistic ways of looking at your mental health and prescriptions or wellness that might be good for you and your family as well. I have a link here to a very common, it may or may not work, common diagnosis that video kind of alluded to. And there's many pages like this, but the big ones are here. So here's an example: anxiety disorders, attention deficit disorder, hyperactivity disorders linked together, a bipolar disorder where you might have depression and you might have mania or very high active periods of your time together with your family or your friends, and they're like, wow, you're really manic, and you're also at times low energy or depressed. Borderline personality disorder, depression, dissociative disorders, eating disorders, OCD. So that list goes on and on. And there's many of those online. You can even find them in time if you are interested in what are very common diagnoses. Most of these are not diagnosed in children, but they might have a child-friendly version of that, where you start to see symptoms and then it evolves. As they get older, if those symptoms continue, they might have adult diagnoses.
Mental health conditions are more common than you may think.
Sorry.
1 in 5 youth.
It's an autoplay. We learn how to help ourselves and each other if an injury or illness happens. We all just got our first aid certification for CPR just on Monday as teachers. Pressure to stop bleeding, ibuprofen for a fever, going to the doctor for medication. But if someone you know is experiencing mental health or substance use challenges, it can be difficult to know the right thing to say. Mental health first aid is like CPR, but for mental health. It equips you to handle in a crisis, like anxiety attacks, depression, or suicidal thoughts, until professional support may be available. You may need to remain respectful and understanding of your child's feelings, even if everything seems to be working against you as a parent. You should avoid getting angry at them for behaviors that are not under their control. This doesn't mean that you can't set limits or impose discipline. Ideally, structure is good for most children, and keeping the structures and the routines that you have in your household will actually be beneficial for someone that is struggling to deal with something new. What it means is that you must set those expectations in consideration of your child's mental health. This is often referred to as finding a new normal. I was in an online course that Omni created, and it had some parents talking about, in a bit of an analogy, where they had an idea of what their children's life was going to be, and they used the analogy of a metaphor maybe of going to Italy. They had plans to go to Italy, and everything in their life was set up to go to Italy and enjoy the food and the culture. And they had had this plan many years in advance. And then when they got on the plane, they landed in Holland. And they recognized this is not Italy. The language is different, the food is different, the culture is different. But Italy was never going to be available for them again. And they needed to come to terms with the change that was out of their control as a parent, and out of control of the children's perspective as well. And they needed to adjust to enjoy their life going forward. Otherwise, guilt and shame would just stay with them and kind of taking that over. So although it can be hard to accept, people who develop mental health conditions may never be the same as they were before. Or they might be the same and different, same and different, same and different. It just depends on what the type of conditioning or condition that they have. So expecting those standards of behavior from before the onset of a mental health condition might just cause you frustration and stress for everyone involved. So this is something to keep in mind. Just like as your child is different when they were 8 years old as they are when they're 16 years old potentially, there might be something very different about them that we'll all have to cope and deal with. So I'll pause a little bit for the time, for those that might need to read. All right. So what can we do? Is there something that's easy to remember, maybe using acronyms, to help us facilitate in the moment how to get from I'm noticing something that might be scary for me as a parent, scary for me as a child, and then that bridge between getting them some professional help. So the term algae, this is what the wise people who like wordplay came up with for you to go through. It's not step 1, step 2, step 3. This could be in any order. And in general, you might say this is common to anybody that's having a different type of problem to understand and have empathy for. So we'll go through each one. I found the Thai versions. I'm hoping that it's correct. It was on like a Thai mental health page, so I'm assuming that at least the titles are close to the acronym. The ALGE option, the action plan here, is a step-by-step guide for mental health first aid. The A, approach, assess for risk of suicide or harm. Try to find a suitable time and a place to start a conversation with that person, keeping their privacy and confidentiality in mind. If the person doesn't want to confide in you, encourage them to talk to someone they trust. And this is to recognize, is there a life-threatening, is there a moment where there's a safety concern, where you might need to separate them from where they're at, or put them in a place where they can be monitored. If it's not something you can handle as an individual, do you need to call someone to help you in that moment? The same way you might call an ambulance for a physical health issue. You call an ambulance for a mental health issue. The L is listen non-judgmentally. Many people experiencing a challenge or distress want to be heard first. So let that person share without interrupting. Try to have empathy for that situation, even if it's something that's totally new to you. You can get the conversation started by saying something like, I noticed that you're struggling with this issue, or I noticed that something's different about you. I noticed that you're sweating profusely, or I noticed that you're talking to someone that's not there, or that you haven't slept a lot lately. Is there anything that is going on? They might be able to start talking, and that might help them in that moment, and then you can decide if it's a father, mother, caregiver situation, what you might do for next steps. Try to be accepting, even if you don't agree with what they're saying. Now is not the time to challenge them. Well, you should have listened to your alarm, or I told you not to do that, or something. This is not that time. So the G, give reassurance and information. After someone has shared their experiences and their emotional state with you, be ready to provide, if you can, useful facts. Maybe you take some time to look together for a solution. They might be intimidated, or they might not have the capacity emotionally or physically in the moment to really deep dive and do some research about what's going on with them. Maybe spend some time together if they're open to that. It doesn't have to be in this order either. It can be in any order that you come across it. So it could be G-A-L-E, or it could be another version of that. The first E is encourage appropriate professional help. The earlier someone gets help, the better their chances of recovery. So it's important to offer this person the opportunity to see someone and offer them the help that exists in your community. So that is important step. The other E, encouraging self-help and other support strategies, helping them identify who can support them in their own network. Have they talked to a friend? Is there someone that they care about that is willing to share with them or be with them? Programs in the community that exist, a personalized emotional and physical self-care plan, or if it's, when we look at that A, that it might be something that might be self-harm or something a little bit more severe than what can be solved in that moment. Do we need a crisis plan? There's also opportunities for that. And I'll share a QR code at the end with a version of a crisis plan that has a lot of good information, potentially for a family. As parents, you're often the first to notice changes in your child's behavior. Mental health first aid empowers you to act effectively and empathically when your child needs support. Unlike other types of diabetes or cancer or other types of disease, there's no medical test that can accurately diagnose a mental illness. Mental illness professionals, as mentioned, they'll do their best to find the symptoms that align with the diagnosis, but it will never be a perfect diagnosis, and life might change from one day to the next, depending on how those situations present to an individual. Play a short clip.
Finding mental health care for your child is possible with the right resources, support, and determination. Here are a few steps to get you started. First, take a deep breath and know you're not alone in this process. There are people out there who can help. Give your pediatrician a call. They can refer you to someone who specializes in mental health. Reach out to your kid's school counselor or nurse and see what they can offer. Consider talking to a friend or relative who's been through the same thing. They may be able to offer you some good advice. Or you can get connected with local groups like NAMI, who provide support and education for parents and caregivers. Finding mental health care.
There is a list of providers that is somewhat vetted, but it's hosted by the International School of Bangkok. We have that list here at school. If ever a parent needed it, we can share that out if necessary, or give a couple of referrals. We have people with mental health struggles here, and they go see sometimes the same person or a few different providers. I myself have access to the community, and we have the expertise to at least refer someone that we believe is reliable. And then as our network grows, and as we have more families, we might expand our network to a variety of symptoms that might be covered by an issue your family might have. But there is help out there, for sure.
Finding mental health.
Creating a safe, supportive environment at home that promotes trust, open communication, and emotional well-being among family members in a psychologically safe home is ideal. Individuals will feel comfortable expressing their thoughts, emotions, and concerns without fear of judgment or rejection. This foundation of safety strengthens family relationships and fosters a sense of belonging, acceptance, and support. And that is generally the idea of psychological safety. So as I mentioned at the very beginning, often this is used in a workplace setting. It's the term of psychological safety, but this is true at home for children and individuals in a relationship, husband, wife, spouse situation, other situation. And the concept of psychological safety generally is that you feel safe to be successful or potentially fail in whatever your ventures are, and that you will be respected and your self-worth won't be affected in that way. And that's exactly what it says on the board. So I'll give it a high definition there for a minute. So here are a list of things that is ideal for you to work on in your family units. As parents, if you're doing most of the things that are listed here, your child should have a foundation of psychological safety. And we try to mirror these things here at First Door as well. Because young adults are more prone to mental health issues and interested in receiving mental health support, they look for environments that foster psychological safety. Young adults in psychologically safe places perform better. Over time, the lack of psychological safety in personal and professional relationships can damage young people's self-esteem, mental health, and it's important to do those things that are listed here to prevent them from having a trending negative psychological safety feeling. It just so happens that there's recent research on the role of psychological safety in fostering creativity in students engaged in PBL, so very versified research. It explores the mediating role of psychological empowerment and the moderating role of fault-tolerant culture in a relationship, so between the school and the child. So key findings included that it positively influences students' creativity by reducing interpersonal risks, encouraging free expression of ideas, and fostering collaboration, psychological empowerment as well. It acts as a mediator that enhances autonomy, competence, and relatedness. So a place like Verso, where people practice things in a safe environment, they make mistakes, they're rewarded for trying, it gives them the psychological safety to continue to try, be creative, and really extend themselves. And that research follows through with that. So I'll say it out loud, although it's not on my presentation notes, I just put it on the slide. There are places here at Verso to receive support, and the counselors that are here in the room are a part of that. Learners in the upper loop have advisors for pastoral care, and we have a culture where we are eager to learn about our students, and we check on our students as often as necessary, and sometimes more, so that they know we're here for them even if they're not accessing us on a day-to-day basis. We are around, we're visible, we're seen, we have supports for them. Again, we can refer out for things that are not school-based, or if someone might need an assessment for something, we send that to a certain number of providers that a family can choose from, and we can take that data once we establish that relationship, and we can make plans, whether that's an academic plan or a support plan for their mental health needs as well. Version of that. Okay, so lastly, I wanted to show you what NAMI calls their mental health crisis plan. So if you want to scan that with a QR code, you can. It'll take you to, it should take you to a PDF, which I have downloaded as well, which I can show you. It starts off with a lot of good information and statistics, and then it outlines things that a parent or a caregiver or even a good friend or a self-diagnosed type of person might look to